are any changes, then you can now proceed to go ahead and do the colonoscopy. So for the hypertension, I think what I would just say is everybody is different. And that's one thing. I think we talked about medications last week. I don't know if she mentioned that if you have any illness or any chronic illness like hypertension, diabetes, do not, because your husband or your wife or your sister is also hypertensive or diabetic and they are using metformin, you will now decide to go and use it. Your body is different. The way your body will react to it, the way that drug will work in your own body is completely different from the other person. And that's why some weeks ago I said when, the advice or the counsels that we give to patients, they are different. They might be the same, of course. There's something right, there's something wrong. But we will streamline it based on the patient sitting in front of us, based on the history, based on the examination, based on the investigation results, investigation findings. We would make our decision. So 2 people might be diabetic, and the decision we make for the 2 of them are different. 2 people might be hypertensive, the decisions we make for the 2 of them are different. So it means the fact that someone has hypertension, chronic hypertension, and she survived till 100 years, does not mean that another person, in fact, her own blood pressure might be 200 and she survived. Someone else might have blood pressure of 160, 170 and they will collapse. So 2 people, every 2 human beings are different. You understand? Every 2 human beings are different. So if you have hypertension, do not look at your neighbor and say the hypertension is not killing this person now. So, So I think that's basically what I would say about that. Then one thing I didn't mention is PSA for men, prostate-specific antigen, and I mentioned it some time ago. So only men have prostate. Females do not have prostate. And the major risk factor of prostate cancer is being a man, because every man has prostate. So the way you can check, there are 3 things that affect men when it comes to prostate. Number 1, BPH, benign prostatic hyperplasia. So it basically just means enlargement of the prostate, right? Normally, once you are above 60, there is a normal slight enlargement that can happen, as long as it's not disturbing, right? But once the prostate enlarges so much so that it starts disturbing, starts giving symptoms, starts giving urinary symptoms or any other symptom, then that must be checked and it must be managed. So BPH, you have prostatitis, inflammation or infection of the prostate, and of course you have prostate cancer. So for you to know whether you have it or not, the best thing to do is to check the PSA. And I said the PSA, the normal level for the PSA is 0 to 4. If your PSA level is within 0 and 4, you are fine. But if it is more than 4, even if it's 4.1, you need to go for further evaluation, because it means there is something going on there. And the faster or earlier they pick it, the better it is. Praise God.
So there was one I forgot to answer, the breast cancer question. So the question was that they told someone to get married early so that if she's breastfeeding, maybe it will reduce the risk of breast cancer. So there are certain risk factors of breast cancer. So breast cancer usually happens, and that's why it's more common in females. So it happens, or anything that will cause an increase in the level of a certain hormone called estrogen. So estrogen has a major role to play in breast cancer. So anything that will cause persistent or prolonged increase in exposure. We know that estrogen is a normal hormone in females, but there are certain periods of our life where there is no exposure or minimal exposure to estrogen. So what are the risk factors of breast cancer? 1, early menarche. Menarche means menstruation. So if a woman starts to menstruate very early, it means that her exposure to estrogen has started really early. So that's the number 1 risk factors, early menarche. Late menopause. If she stops menstruating too late, it means that she has had, imagine someone starts menstruating early and stops menstruating late. It means she has had a very long duration of exposure to estrogen. So using certain medications like oral contraceptives, so oral contraceptive or some other contraceptives, so they have estrogen in it. So it means you are exposing yourself to more estrogen. Another risk factor is reduced parity. So parity means the children you've given birth to. So during pregnancy and also during breastfeeding, the level of exposure to estrogen is less. So that's why I said women are unique. The different hormones work in different ways. They are exposed to hormones at different levels depending on what is happening in their life. So during pregnancy, it's progesterone that is more. So there's a change, a switch in the hormone she's exposed to. So during pregnancy and also during breastfeeding, the quantity of estrogen she's exposed to is less. So maybe that's the point of view the doctor was coming from. But I would not say because I want you not to have breast cancer that you should go and get married early. There are so many other things that you can do to prevent. I would say, okay, try not to use oral contraceptives, do certain things. Or if you have a risk factor of breast cancer, a family history of breast cancer, okay, make sure you keep examining your breast or do things like ultrasound scan or mammography so that you'll be able to identify it early. And then you mentioned that there was pus coming out and so many things were happening and she was still breastfeeding. It means she was trying to keep to the counsel of the doctor. But once pus is already coming out, it means the cancer has advanced. Like it has advanced so much. So there's breast tissue and there's an overlying skin. It means the cancer has spread into the overlying skin, and I'm sure she will have so many other symptoms. So at that point, I know we encourage breastfeed your babies, but at that point, her health, she was meant, okay, at that point, it would have been encouraged that she stops breastfeeding, do certain things. They might have done a mastectomy, which is removal of the breast, and some other things. So I hope that answers the question.
Let me celebrate Jesus. Thank you. Thank you very much. Please continue to celebrate them. Wow, that's been awesome. Thank you, Dr. and Dr. Mrs. Ogunwumi. We are indeed very, very grateful. Very grateful. Very grateful. The Lord will bless you. The Lord will honor you. Thank you so much. May I call on the...
Good morning, church, and happy last Sunday in November. Give Jesus a big round of applause for seeing us thus far. It's now time for Sunday school. We are going to have a Sunday school before the main service so that we can have our time. And the topic we are discussing today is the transforming power of grace. We are all saved by grace. We were once dead in sin.